Hello, I'm Jim Sapersky, and welcome to Mental Health Care Today. We're so excited about today's guest. Dr. Hansa Bhargava is a staff physician at Children's Healthcare of Atlanta. She's a senior medical director at WebMD and senior medical director and correspondent with Medscape Education. Hansa is a noted thought leader in innovation, in mental health, in maternity, and with a strong emphasis also in pediatrics. Dr. Bhargava is frequently speaks on the topic using current digital footprints to elevate data in education to help disparities, opioid addiction, and mental health. Dr. Bhargava serves on the board for Emory University's Global Health Institute and Christopher Wolf Foundation, and she is an executive member of the Committee on Communications and Media for the American Academy of Pediatrics. Hansa, welcome, and thank you so much for joining us today.
It's my pleasure and honor, Jim. Thank you.
Well, let's jump right in. Hansa, what a weird, strange last year it has been across the planet. Can you tell us what you're seeing with the pandemic as it relates to mental health care? And are there specific related challenges that we face here in America that are different from the rest of the world, excuse me?
Yeah, no, I think that it has been a very strange year. And, as we coped as a nation with COVID and all its fallout, I think now we are unfortunately set up for the second fallout, which is probably the mental health pandemic. And we know that mental health was an issue before COVID even struck. But unfortunately, I think COVID's catalyzed that issue, and especially with the social isolation, we're already seeing some of the fallout. The survey that was done by Kaiser showed, that 4 in 10 adults in the U.S. have reported symptoms of anxiety and depression. We know that the youth we're seeing increased anxiety and depression in that group. And a recent survey done by Sapien, the organization, on 8 English-speaking countries, over 48,000 people in that survey showed that 1.25 of people are reporting issues with mental health, and over 50% are reporting some sort of adversity related to COVID. So yeah, we have the fallout and we have lots of work to do.
So tell me, as it relates to that, I mean, if you've worked with digital technologies and you've looked around some of the other areas that you're touching, what are some of the gaps that you're seeing as it relates to that? We all tend to think that technology can fix all problems. We know that's not the case, but this strikes me as it's an area that might be helpful.
Yeah, and I think just going back to mental health for just a second. Mm-hmm. The thing is that mental health issues have been on the rise for a while, and now it's been just completely exponential with COVID. But what the problem is that the mental health access has been pretty much, stable. And if you look at all the states, there are many states that aren't even, even before COVID, weren't even meeting 50% of the mental health needs that were out there, right? And then we have the second crisis also as related to that. And that's basically, healthcare workers and, how health systems have suffered during COVID as well. And there's so much devastation from that perspective, both from the healthcare workers being burnt out, but also the healthcare system suffering as well. And so I feel like, yes, technology could potentially be the bright light or the silver lining around this cloud, in that COVID's kind of shown everybody how technology could potentially fill in some of those gaps.
Very good. Quick question, because you have some fascinating projects that you're working on right now, and I was reading through them in the area of mental health. Can you tell us a little bit about what you're working on?
Yeah, I've been really excited, Jim, because I was focused on this before, and I'd done some talks, and we had done some work with opioids, and now basically, over the last 6 months to 12 months, I had opportunities to work directly with education for healthcare workers and their burnout. I was really excited and fortunate to have the opportunity to produce a program called Doctor's Dilemma of Overcoming Burnout on Medscape, which is like a 6-part series using some of the Emory University's CBCT philosophy to help people with burnout and for resiliency. In addition to that, I'm really excited that we're working on a curriculum for a health system for healthcare workers around the same issue. And also, lastly, but certainly not least, I've been working on a book which I will be publishing with the American Academy of Pediatrics. It's slated for publication early next year. So I'm very excited about all of those things, and all to really help in the mental health arena.
That is excellent. I mean, I'm curious because we read about it and I see it all the time in the papers, and we talk about the toll that the pandemic has taken on healthcare workers and healthcare professionals. And I don't think we can overstate that. I mean, just from your personal experience, I mean, how do you do it? How do people do it day to day? It's got to be off the charts traumatic.
I totally agree with you. And I think it's similar to, like, war veterans. I know that it may seem like a hyperbole, but the problem was that our healthcare workforce was already somewhat burnt out. If you looked at the surveys from, early 2019 prior to the pandemic, and now basically it's insult on injury, right? Like, it's just like, it is a lot. So I think that is going to have to be part of our work. And that really directly affects the mental health care of patients as well, right, Jim? Because if the healthcare workers can't cope or are just overburdened and tired and have moral injury, then how are they supposed to help the patients? And so it's almost a domino effect.
One of the words I've heard you use before talking about this and talking about healthcare work is resiliency. And maybe it's just people getting up every day, putting one foot in front of the other and showing up. But resiliency is a word, I mean, that we don't talk enough about, in my opinion, and what that means. So, what are some of the things you've discovered or found, or what are some of the ways that, even just within the healthcare profession, that people are coping, and how, what levels of resilience, what strategies are being implemented?
Yeah. And so I think resiliency is really the ability to, get up when you get knocked down, to pivot in the face of adversity, right? And I think the healthcare workforce was somewhat fatigued initially. So I think at this point, to teach people mental health prevention tools, I actually think about it similar to what we talk about when we talk about chronic disease, such as diabetes and hypertension, prevention of heart disease. And what we tell people is that we need to try and prevent that. So, go and exercise, sleep well, nutrition, keep your weight a certain. I think that we should look at mental health in the same way, Jim, in that let's teach people the skills and the toolbox that they need, because look, life happens, and we know that all of us, every single one of us, will have adversity if we haven't had it already, right? And some of us, unfortunately, have even more disparities and are even more prone to that. But the bottom line is, especially for healthcare workers and a lot of us, like, if we have those tools given to us on how to prevent things from getting worse, then that's resiliency right there. Like, what do I do when I get knocked down? What do I do when something bad happens in my life? And I'll tell you, like, personally, I had some not so great things happen to me last year as I was going through the CBCT course from Emory University, and the CBCT course really helped me. So I'm a strong advocate for the Emory University course. In fact, so much so that I certified as a trainer, and I'm almost done that as well. I'm teaching a course right now at Emory University on it.
That's excellent. Do you feel that there's any stigma in terms of some of the workers taking advantage of some of those courses? Are people embracing it like they should, for instance?
I love that question, Jim, because I do think that there's some stigma. And it was just really interesting because I was in a meeting recently, and it was about the education and resiliency. And the program that we did for Medscape is called The Doctor's Dilemma of Overcoming Burnout, for example. And somebody in that group said, well, that's great, but should we call it burnout? Because there's stigma about burnout. Like, people will say, oh no, I'm too tough for burnout. And that's just interesting, right? I mean, I think there's a lot of people who say that, but similar to a person who doesn't identify that they're necessarily depressed or anxious, people who are burnt out may not know that they're burnt out, right? And resiliency is also something where you can actually step away from yourself and say, oh, I'm not feeling great, or I don't think I'm in a great mood, or I feel like I might have depression, and be able to identify that. But if you're in it, it's very hard to identify that. So that's a lot of learning that I think everyone needs, and it's just so important. Jim, I know I'm talking a lot, but one thing I will say is that, look, if we don't have emotional well-being, we can't do anything, right? It affects every facet of our life. It affects our productivity at work. It affects our ability to succeed academically, to get that promotion, to get along with our coworkers, and it affects every facet of our life outside of work as well. Our relationships, how we handle things. So it is just such an important thing. And, the CBCT program at Emory University and writing this book really made that very clear, that we need to keep that lens clear and certainly look at it as much as we do with physical health, and focus on prevention as well as treatment.
Well, that's great. There's two things that, I'm a huge believer in. We are, and at least in our work, is one, mental health care is healthcare.
Yeah.
You can't really differentiate it, and they need to be treated that way. The other is, it's happening so young, and I know you see this in your work with the Children's Hospital, but it's affecting so many children even at a young age. So one of the other things is screening people and doing a better job of screening people, knowing that a lot of this falls on primary care, falls on ER docs, falls on people that are not trained psychiatrists or psychologists. So, how do you look at screening, or have you seen that be implemented correctly or incorrectly, or not at all in some cases?
Yeah, and I just want to just tag back to what you just said. I do think it affects physical health, and that's the thing, right? Mental health and stress absolutely has effects on physical health, and we know that from ACEs as well, right? Like all the research that's been done on toxic stress. So I think that we need to try and find methods, and maybe using technology, to make it somewhat of a simpler task to diagnose people, right? And then a simpler task to connect people with treatment. And so, part of that is using digital technology. Is it on the EMR that we have a simple screen like your organization does? Or is it like an app that the patient kind of brings in with them? But doctors and nurses and mid-levels are overloaded right now. So we have to acknowledge that, but we still have to acknowledge how to get the mental health care to the patients that need it. And so digital is an awesome way to try and close that gap.
Along the same topics, have you seen, there's an explosion of telehealth, for instance. What is your view on that? Have you seen as it relates to mental health care? Because it strikes me that it's been very effective in that arena, but I'd love to hear your thoughts on that.
Yeah, no, I see it. I see an explosion of telehealth, but also digital diagnostics and, digital therapeutics. So I think, it's a wonderful time in healthcare that way, because, there's companies that are looking at the entire spectrum of diagnostics to solutions. And telemedicine is one part of it, but I'm just really excited, Jim, about, the potential for us to be able to solve some of these issues with digital.
Wonderful. Well, listen, how, for some of the work, for the production you're doing, for the book that's coming out, how can we direct our listeners to learn more about your work and tune into your documentary series, myself included? I would love to hear that. Can you some information you can provide us that we can put out as a part of this podcast?
Absolutely. So for healthcare workers, the series is called The Doctor's Dilemma of Overcoming Burnout. You can just Google it, and it's in Medscape. So that's one thing. The book and blogs that I write for consumers can be just found under my name at WebMD. I've written a lot about mental health. And lastly, my website, Hansa Bhargava MD, is a great source. And I also post on social media. So you can find me at Hansa Bhargava MD on Twitter, at Dr. Hansa MD on Instagram, and then of course I'm on LinkedIn as well.
Wonderful. Hansa, thank you so much for joining us today, and thank you for your insights. This has been a great session, and would love to get you to come back sometime. I feel like we barely scratched the surface of some of these topics, but I'd love you to come back at some time in the future if you'd like to do that.
I would love to do that. And I'm so grateful to have this conversation with you, Jim. And thank you for all the great work you're doing.
And no, our thanks to you for the great work that you're doing. And thank you all for joining us today on Mental Health Care Today. Have a great day. Stay positive.